Hey, good afternoon, everybody. This is Jonathan with AlphaCentric. Thanks for joining us for this week's Life Sciences and Healthcare call. Super stoked to have Ryan and Anna with us again today. Today's format's a little different. As you know, the JP Morgan Healthcare Conference is taking place in San Francisco the week of the 13th. So Ryan and Anna are busy, 60 some meetings going on over that time. So we wanted to get this out at the regular cadence, but we're recording it a little bit early, just a week early. But with that, man, it's a weird start to the year. Holy cow, I'm looking at the markets. Not as weird with the healthcare. There's not as much news, but the markets are weird enough, so there's lots to talk about. So with that, I'll turn the time over to Ryan and Anna and really look forward to this week's call.
Great, thanks, Jonathan. Yeah, it's been a an interesting end of the year and an interesting start to the year, and not to rehash too much from the prior 2 months. And I'd encourage you all to go back and listen to those November and December calls if you haven't, because I think it's a really good um, overview and setting the stage for what we're experiencing in the start of 2025, which of course is uncertainty in the healthcare market that I spoke to last year. Uncertainty driven by politics, by President-elect Trump and his nominees for various healthcare agencies, uncertainty introduced into the managed care space after the murder of a United Healthcare executive, and there's a resulting sort of backlash against some of the insurers. It's created, and I'm going to use the word uncertainty again, uncertainty in healthcare. But we're actually quite excited about healthcare in 2025. We'll see if that proves correct, but I think there are some compelling reasons to be constructive on the sector. And the first is valuation. And I showed a chart last month. I won't show it again this month, but it speaks to the price to earnings disconnect in 2025 for the broader healthcare world versus the S&P 500. So I think this is an interesting starting point. We've seen valuations come down towards the end of 2024 and into 2025. And does this offer compelling entry points for healthcare stocks? And we believe that for long-term investors, it can be a compelling opportunity. What we need to see in 25 to have this prove out, though, is some certainty and some conclusion to these questions in the market. And we believe that we will start to get certainty on a lot of these open questions as the year progresses. So we're going to have hearings on President-elect Trump's nominees in front of Congress. That will provide some clarity on what these individuals want to accomplish, what the Trump administration hopes to accomplish. Will all of these individuals be approved? Will some of them be blocked by Congress and President Trump will have to renominate other individuals? That will be interesting. It seems like President Trump has focused more on the PBMs versus the pharmaceutical companies. So remains to be seen, but could be a net positive there for pharma. We also need to get back to a steady stream of positive revisions in the healthcare space. We had some negative revisions into the end of the year. We had a lack of positive revisions into the end of the year. And so JP Morgan, that Jonathan mentioned, is the biggest healthcare conference of the year. We'll all be at that next week. The entire healthcare world, frankly, will be at that next week. If you haven't been to it or read about it, I'd encourage you to do so. It is something to behold with all of the investors there. But that is where all of these companies will set expectations for 2025. We've seen a number of pre-announcements this week. We'll see more next week. So that will be a great expectation setting moment for the year. And it will give these companies an opportunity to go out throughout the year and hopefully outperform those expectations, show positive revisions, which really will get people, investors, generalists, re-excited about the healthcare sector. So that some clarity on the political uncertainty in the marketplace will be two key catalysts. And the third catalyst, and we've started to see some of these this week, it's just a reminder to investors of the value that exists in healthcare. And we've seen that through a couple of takeouts, specifically in medical device land. So we saw Stryker purchase Inari for a really nice premium. It's a medical device company that they're going to tuck into their business. Also, a really nice premium there. We saw Boston Scientific acquire the rest of Bolt Medical, again, another medical device company. We'd expect more M&A, quite frankly, throughout the year. Typically at JP Morgan, there's M&A announced really on Sunday, Monday, even sometimes on Tuesday. So perhaps we've pulled this forward, but I would look out to next week and see if there is potentially more M&A. So these are the things that can really catalyze the sector, get people excited, and we're excited to get started. So with that, I'll turn it over to Anna. She's got some biotech hot topics to cover.
Yeah, and before I do that, just following on what Ryan said about takeouts. So already before JP Morgan, we have GSK, which is acquiring a small biotech company that's private, actually working on cancer, another rare cancer indication. And so already it's starting in biotech land as well, not just med device. And then as Ryan mentioned, thinking more big picture, right? So we're heading into JP Morgan where we'll get a lot of very specific data points, but thinking big picture, where do we want to put our money going forward? What are the hot topics in 2025? Some things I thought were interesting and worth highlighting, one of which is that the FDA actually just published formal guidance on the use of AI in drug development. I feel like AI is one of those hot topic words, has been for the last year, maybe a year and a half. But now I feel like it's kind of losing its shine and is becoming more like everybody has AI, everybody's using AI. And now it's about how do we use it in the best way to get the best outcomes. And so the fact the FDA put out formal guidance is kind of cementing its place in drug development, which I think is very cool. So thinking about companies which put AI at the forefront of their research and thinking about how companies might use it to accelerate their processes, I think is something to keep focused on in 2025. Another thing is cancer screening and diagnostics. This might sound kind of boring, but if you think about, especially in colorectal cancer, there have been huge advances over the last few years, going from an invasive procedure, which is a colonoscopy, to something that's called Cologuard, which is already on the market. And now there are companies, in addition to Exact Sciences with Market's Cologuard, that are making more sensitive, more precise cancer screening for colorectal and other types of cancer. And then in addition, diagnostics. So once you've already had your cancer and you treat it, there are now very precise methods of detecting if it's come back after treatment. And those are getting better and better. And so there's a publicly traded company, Natera, which currently has one of those on the market. However, and then they were the first to market. And so they have a huge share, but they're still only getting less than 30% of cancer patients. So there's so much growth that can happen there. And there are numerous other companies sort of up and coming, looking for reimbursement or approval to get on the market. And then not GLP-1s, but GLP-1 adjacent. Now that so many people are taking GLP-1s, right? So the weight loss drugs, like Wegovy and Mounjaro, people are realizing that the nausea and the side effects is in part due to diet and lifestyle, that they're basically trying to eat too much or eating the wrong foods, and that's leading to discontinuation of these drugs or poor outcomes. And so one thing that's happening now is that numerous companies in the nutraceutical space are actually developing products that go along with these drugs to help people get enough protein and other nutrients while eating less, maybe less fat, less calories overall in the day. And it's actually hopefully going to lead to better outcomes, both because of better compliance, but also more weight loss. So I thought that was interesting. Okay, and then last one, I know this is a lot. A very small biotech company, this is maybe the most exciting one, a very small biotech company called Sana Biotech actually just announced in one patient, so very low N, that they have introduced a cell product that's genetically modified that can actually produce the insulin that patients can't produce when they have type 1 diabetes. And so in one patient without immunosuppressive therapy, they were able to effectively, temporarily maybe, cure type 1 diabetes, which is something that has never been done before without repeat testing and injections. So this is incredibly exciting. Obviously, we need more patient data, longer follow-up to see how long these cells persist in the body and how long they keep working. But I mean, that data point is just so exciting for so many people. So I just did want to highlight that. I know that was a lot.
Well, it's a lot of notes to take and go down. Well, this has been great. Thank you guys for taking the time, as always, to go through this. I've got a lot of notes to take. We'll post some of the notes on Alpha Watch there. But for those who want more information or want to kind of get in touch with it in the future, you'll see a pop-up survey come through. It's a great way to get access to the regular monthly cadence that we have with this call, and also one-offs if you have questions. And like Anna and Ryan are so good about using their time wisely, but also helping us see through things. So with that, we'll close. It's going to be a great week. Stay close to the news cycle at the JP Morgan Healthcare Conference, because as always, there'll be lots going on, and let's look forward to a great 2025. Thanks so much, Ryan and Anna, for joining us today, and everyone have a fantastic week and Happy New Year.
Great. Thank you,
All right.
Jonathan. Thank you,
Thank
everyone.
you.
See ya. Take care, guys.